wanted to make it and is not able to make it today. So the recording has started. So my name is Monet, your family health advocate. After in November, I was hired as the community coordinator here at the Office of Family and Child Health. So yes, I'm now the community coordinator, and I'm also still your family health advocate. Stephanie is she's not able to be here tonight, unfortunately, but I do have our newly hired father engagement specialist, Josh, here is going to help me monitor the chat and make everybody feel make sure everybody's questions get answered. So I just want to introduce our man of the hour. We have Dr. Daniel Shaw. He is the director of the Center for Parents and Children and the Pitts Parents and Children Laboratory. He also serves as a distinguished professor in the Department of Psychology at the University of Pittsburgh, with joint appointments in the School of Medicine and Education, the Clinical and Translational Science Institute, and the Center for Social and Urban Research. So without further ado, I'm going to let Dr. Shaw give his, go ahead and take over. Thank you, Dr. Shaw, for being here with us.
Thank you very much, Monet. Yeah, it's a real pleasure to be here. And I wish I could be in the same room with everyone, but this will work, I think. Today, I'm going to tell you about, it's a two-part project. Can people see the slides then?
Yes.
Right, good. Okay. You have a title slide. Good. Good. And you can see it's called the Family Checkup, a brief intervention for parents with young children. So I'm going to spend most of the time talking about that and then tell you about what I think is an exciting, we call it a study, but it's really just a way of engaging families in different interventions that might be good for them. Or not. And so I'm going to tell you about that. My partner in this is Dr. Ann Gill, who's the co-director of our center here at the psychology department at Pitt. Okay, next slide. This is a parenting group, so I shouldn't have to tell you that parenting matters. But if you, and the theme of this and the Pittsburgh study you'll hear about in a little bit has to do with if we make parenting support programs more accessible, will more parents take advantage of them? If we make them as easy as possible so they can have them in their homes or at a library or wherever it is. And some of that has been my recent efforts in the last 10 years. I spent a lot of time researching in Pittsburgh of families, mostly low-income families who don't have a lot of resources, and what makes things go right or wrong for their kids. We have one sample of boys who are now 32 years old. We follow them since infancy. Another group of children you're going to be hearing about who we picked up when they were 2, and half of them were randomly assigned to this family checkup intervention. They're 19 years old now. So we've been watching a lot of families grow up. Some of them have been able to get support we provided too, and others we've always been referred out to. Anyway, so in terms of parenting matters, more than 3 decades of research has demonstrated the effectiveness of these early home interventions to really improve outcomes for kids. And several have shown modest to longer term evidence over time, but that list gets to be rather short when you also look at interventions that can engage families, where they feel like this is a collaborative process. This isn't being done to them, but with them over time. So I'm going to introduce to you the family checkup, which we think kind of brings that collaborative, strength-based spirit to this idea. Yeah, so it's important to demonstrate that intervention produces outcomes you want, but also that it will engage families, that they'll feel part of it and accountable for what we're doing. So you're going to be hearing in the next few minutes about this family checkup. This is the big overview, but I'm going to show you a video in a minute after this slide. But just so you have a background about it, it's an intensive strength-based service for families with children at risk based on contextual stressors, things that get in the way. Most of our work is focused on children 0 to 5, but the family checkup actually goes birth to age 18. And we're working on a prenatal program right now, too. You'll hear about it, you'll see about it. It's delivered by, usually folks have master's level clinicians. Sometimes someone has a college degree, but they've gotten so much experience, they qualify for this too. It started by trying to capitalize on parts of childhood that seem to be more stressful than others for parents, including what's called the terrible twos during the toddler years, but also adolescence, early adolescence, when kids are going through lots of changes and parents are too. You'll see in each of these versions of the family checkup, there will be 3 parts. You'll be sick of seeing slides about that by the time I'm over. And back in when President Obama came into power in 2008, it was selected as one of 7 home visiting programs that the federal government supported by what's called the McV, or I can't even get all these the initials here, but it had to do with groups, so states could actually apply for funding of these 7 programs. That list is about 15 or 16 now. And for home visiting models, it's pretty cheap. A lot of models cost $3,000 or $4,000 per year per child. And you'll see that the family checkup's pretty quick and cost a little less than about $500 per year over time. So I'm worried. Let me know if you are. I know you're not. Oh yeah, here we go. This should work. Let's see if you can hear this.
Your turn.
You hear this?
We
Yes.
know that parents want the best for their children. We also know raising children brings a lot of challenges.
Many parents say that parenting is the most rewarding, yet the hardest job they've ever done.
The family checkup is an effective method for addressing the many challenges of parenting.
Like a pediatric visit, we meet with families for a checkup. But this time, it's about their child's development and behavior.
A trained family coach will first spend time getting to know the family, then share direct feedback about child and family well-being.
Building on strengths, we work with families to reach goals they have for their child.
These 2 to 3 meetings take place at a family's home or wherever is most convenient.
Hello. Hi, Kayla. Frida, very nice.
Parents also have the option to continue meeting with the family coach after the feedback session to support their child's development.
The family checkup is an evidence-based, 2-generation parenting intervention designed to prevent child problem behavior. The family checkup is brief, typically taking place over the course of 3 sessions, each about an hour long.
The first step is the initial interview, and it's designed to build rapport and a relationship that will support the remaining components of the intervention.
We really, right from the start, are partners with parents in this. They know their children best, and they are their child's best teacher.
They make time for us, like in our schedules.
This person's coming to help me become a better person and a better mother, and also help my child excel as well.
The second step is a comprehensive assessment that explores child and family adjustment and relationships. The assessment includes questionnaires about areas that impact children and families.
A unique component is the careful use of video-based assessment, where parents and children take part in activities that demonstrate their patterns of relating and communicating.
It was a great experience. They filmed it so I could see just different stuff as far as like me playing with her and how she reacted.
And it really lets them see themselves in different lights. It works.
The third and most powerful step of the family checkup is the feedback session. The family coach meets with parents to share the results of their assessment in a conversational format.
The purpose of this feedback session is to enhance caregiver understanding about their strengths and challenges in a way that motivates them to take action.
Parents are then invited to set goals for their child and themselves to support and maintain strengths, as well as address areas of concern.
They talked about social skills. They also talked about coping methods.
It's very still encouraging and empowering, like keep up what you're doing.
After the feedback session, parents can select from a menu of options for follow-up services, including managing child behavior and improving parental well-being.
How often would you like to meet?
At this point, I think, once a month.
Depending on what the parent may want, I may start to work with them weekly or seeing them monthly, or maybe do some phone check-ins, or even just provide them with some general resources.
More than 25 years of research shows that the family checkup leads to positive outcomes spanning from early childhood to adolescence.
In early childhood, these positive outcomes include better self-regulation skills, fewer conduct and emotional problems, and less conflict with parents. At school age and through adolescence, these positive effects translate into better academic achievement and better relationships with peers and teachers.
The family checkup works by efficiently supporting caregivers, enhancing parenting skills, and addressing contextual factors that present barriers to optimal parenting. For example, the family checkup has been found to lead to reductions in parental depression and improvements in parent relationships so they can best support their child's development.
I've been able to express myself and get a real good reflection of my interactions with my daughter, continuing down the path of accomplishing my goals.
I more so wanted to be here mentally and physically for my children. I also wanted my children to be mentally and physically healthy. It's very encouraging and empowering.
The family checkup.
Building on strengths to give children the best chance for success.
So that was in a nutshell the intervention. I don't know if people can mute who aren't. Yeah, that would be great. Thank you. So you heard about it. Now, what I want to do is bring it alive a little bit. So you heard it's a strength-based intervention. It uses what's called an ecological assessment. That means we want to cover as many domains of children's environment as possible. It could be that there are issues going on with the parents, what parent isn't happy at work, there's something going on at school, there's something going on with the 2 or 3 other kids in the family. So we want to take a rather global view of that. Over the years, you mentioned in the video about showing its effectiveness all the way from early childhood, because we've been able to follow kids as they get into adolescence and even beyond that over time. We've done this work in rural parts of Virginia and Oregon, in Pittsburgh, and suburban Oregon as well. And culturally, it's always been rather diverse because we started here in Pittsburgh, mostly are in low-income neighborhoods a lot, using WIC, Women, Infant, and Children Nutritional Supplement Programs, as our health department sponsors know about. Most of our samples have come from WIC and pediatric clinics serving low-income families. It was designed as a home visiting model, yet it's being used and delivered remotely and in community settings. So we started out at WIC, but we've gone to FQHCs, Federally Qualified Health Centers, Head Start, Early Head Start, family centers, libraries, and now we're in the family courts as well. So we're not trying to take over Pittsburgh, but we're trying to have a strong presence here with it. We think it's pretty adaptable, as you heard in the video, from birth all the way to 18 years, provides a range of clinical services. We think it's pretty engaging. When we were just setting up at WIC sites and around the country at these 3 different locations, we got about 75% of families who were just coming in for a WIC appointment to agree to have a family checkup and try to improve their kids' behavior. That rate was over 93% in one study in Pittsburgh with toddlers, and then 93% also with the adolescent sample here in Children's Hospital Clinic in Pittsburgh too. And then we think it's pretty effective. It supports children's both social and academic competence over time across a broad range of domains. So you saw these 3 parts of the family checkup, and I'm going to go into them in a little bit of detail so you can sort of get a feel of what it's like. And as a parent, imagine yourself being in this situation and what it would be like to get one of these family checkups. It's going to start with this initial interview. Then we're going to do this ecological family assessment. And then the core of the family checkup is this feedback session when parents decide on these goals that were talked about in the video. Each meeting lasts about 45 to 60 minutes. Sometimes the feedbacks can go an hour and a half. So what happens in the initial interview? We call it the get to know you get to know you visit. We're going to start off just explaining this whole process, what's going to happen with you in the next 3 sessions. We're going to start to find out about you, what's important to you, what's important for your family, what are the challenges up ahead. And these can be like the neighborhood you live in, or needing more money, or getting along with your child. It's up to you. We're going to try to find strengths that already exist and build on those. Rather than point out shortcomings, what we try to do is build on things that are already going well. If there aren't many things going well, we're going to find those too for families. There's a technique called motivational interviewing, which really guides these conversations. And MI, as it's called, is a way to get people to be somewhat less defensive about what they're concerned about, by allowing them to talk about things that may not be pleasant or others may not want to hear. And this could be thoughts of not necessarily doing harm to others, but just being angry at your child, things that aren't so desirable to admit. And we do this by allowing it, by setting up context where it's okay to express these issues. Our belief is, and underlying motivational interviewing, is that people won't change unless they feel like they have options, unless they can really deal with the pros and cons of what they're now doing, and in terms of how they're treating their child right now, the methods they're used for discipline, or how they're promoting their child to get to do something they don't want to do. We want them to walk through that and see both the negatives, but also the positives of why they're pursuing goals a certain way. So this ecological assessment involves not only what's going on with your child and the behavior she or he might be presenting, but also what's going on in the neighborhood. Is it safe to get on the bus for your child, for an older child? Do you as a parent feel supported by your partner or at work? Are there extended family members that play an influential role? If they are, we may want to meet with them too, if they're part of the parenting process. So you can see these 3 circles that are intertwined with each other, and it's really hard to separate those. Fortunately, when kids are really young, like the 0 to 3 age, it's a little less complicated. When you get in adolescence, there's all kinds of different venues and domains you have to get into. So one of the reasons we like to keep it simple in the early childhood domain. I mentioned that we're strength-based, and we take that very seriously. So it's really important for our interventionists to find some things that are going really well. And as I mentioned too, ways we can develop those. So if I'm the interventionist, and this is kind of the inside story of it, I want to know what the message I want this parent to hear, something that they already might know they're depressed, but what would promote their well-being? What would get them to be more active with their child? What are the strengths? What are the obstacles for this family? And this is all going to take place before this pivotal feedback session. We're going to get a lot of data from the parents. You're going to be filling out lots of questionnaires. We're going to be watching you in action with your child, and sometimes children, over time. And we're doing that not to point out what things are going wrong, but to find video clips that really say, wow, if we could sustain this more often, things would be really good. So one of the most important aspects for our interventionists, they get certified, and they have to get above a certain threshold to be certified in the method. They have to communicate hope to the families. And sometimes when our families are facing multiple adversities and not doing well, not feeling great about themselves, this could be really challenging. But that's why you need a little background to make this work. So you saw like pieces of one of these during the video. This is the feedback sheet, which we use. So imagine you've had this get to know you session where people have asked you about, what do you like about being a parent? What are the challenges? What aspirations do you have for your child? What's getting in the way right now? What's going on? What are you worried about in working with us over time? Then you have this assessment, hour-long assessment. We watch you, videotape you, and now we're going to share that data with you. And we want to do it in a way that parents can hear, but also disagree with us if necessary. So this is a completed family checkup feedback form. And you see the kind of, we call it a rainbow sheet. On the far left are strengths that families have. And on the yellow areas, we get a little more concerned. And then to the red, we're worried. And we're worried because we have data from our other studies and other folks that say if you have high levels of this risk factor, your child is at risk for having problems later in life. And this could be a child behavior, but also a parent behavior or a neighborhood issue over time. So in this particular family, you can see all the different domains: child temperament, child health, in the middle, family emotional well-being, over time, how the parents are getting along. Do they feel supported socially by their partner or grandparent or whoever they're parenting with over time? And then we have parenting down below. So in this particular example, if we were relating to a family, what was going on with them, you can see there are a couple things that need attention, but all kinds of strengths. So we would start with the strengths, and we would note that your child's health is good. They're on par to be doing quite well over time. Moreover, you and your partner are also reporting to have be in good shape together. You're a team. You're not fighting each other most of the time, although everyone has conflicts, of course. And the other strength, and this is the most important one, is we watched you for 15 or 20 minutes, in this particular case, 50 minutes when we could afford to have long assessments. And you have game as a parent. We saw you anticipate your child's needs during a cleanup task. We saw you knowing how to read your child over time. When your child got upset, you were able to firmly set limits, and you seem to have just a wonderful relationship with each other. So we're going to show you video clips of this, just to cement those and kind of promote your own, not only your own well-being, but your sense of efficacy as a parent, your sense of competence, because that's what we really want to build on. Okay, so it's a sunny day over here, but what about these areas? Okay, imagine this was an 18-month-old at the time, 18-month-old child. Well, it turns out that you're not feeling so good about yourself. This star in the red area, emotional well-being, was really a scale depression. And you have symptoms that are consistent with someone who is clinically depressed. Not good, right? We might review some of those symptoms that you endorsed. And we would not say to you at this parenting intervention, you need to get help. We would say it would be really helpful if you could work on this to promote your child's health. This sometimes gives parents more permission to do things they might not do for themselves, but if they find out if it's for their child's benefit, which it is in our work, we find this, then it really is. And then the other thing we do is we throw kids under the bus. We watched the videotape of all the great parenting, but we also saw how demanding that child was. So even though parents might be a little bit challenged, although this one is doing really well, we would also marvel at their ability to pull this off over time. So even though we're talking about some really serious things, I hope you can see that we're trying to create an image of hope of where to go with this next time. At the very end of that feedback session, we asked parents to identify goals. If you were going to change 1 or 2 or 3 things in the coming year on behalf of the family and yourself and your child, what would those be? This is important, and it's really important here that parents generate their own goals. We might help with the wording, but we're not going to write down, we're not going to make up these things. It's really crucial because these are goals you want to pursue. How you want to pursue them is a separate question, but these are goals we want to get you involved in. And again, this is taking in consideration the feedback the assessment and the get to know you session. Over time, we sign on it, we give you a copy, we keep a copy because we're going to come back next year, just like a well child visit, and see how you're doing. Then a separate decision is, how would you want to achieve these goals? And that might be, I'm good, so long, see you next year, versus meeting every week or every other week to work on specific parenting issues, to get Section 8 housing, to find more resources for jobs, whatever it is, whatever important to you that you think is going to best serve your family, we're there for you. An IEP, some of you probably have had these for your kids, individual education program, we'll go with you to those. We'll role play how you want to do it if you don't want us there. But we're trying to be there for you over time. And then if you choose follow-up sessions, we will follow curriculum from our evidence-based sessions, which will, again, be zoom in on what you really want to work on. So we're not in the habit of meeting with you 10 or 12 times to go over issues, only some of which you said were important to you. We'll only work on those that are meaningful, which is how we do this fairly quickly. The average number of sessions is usually about 4 to 5, 3 of those being the get to know you, assessment, and feedback. So usually families only meet with us 2 or 3 sessions. There are exceptions to that. We have some families go 20 sessions because there are multiple issues, but it's always up to you whether you want to meet and what you want to work on over time. So what have we shown? Well, we've affected, even though it's a parenting program, we see improvements in maternal depression, improvements in parent social support satisfaction, improvements in their parent relationship quality, and of course, improvements in parenting. Even from our observations, lower levels of parental maltreatment. While we're there observing families over time, we see the effects there. We also, importantly, of course, the parenting program, we hope to improve child behavior, and we have. Some of these go all the way up to age 16 at this point, from age 2, better academic achievement in school, better ability to regulate emotions, and better relationships with peers. Few of our kids are rejected by their peers when they're 9 or 10 years old. Something we didn't anticipate, but better BMI for their kids as they hit school age over time, and reduce conflict in parent-child relationships. We have 45 of these different findings for this one sample of kids who were from Pittsburgh, Oregon, and rural Virginia. The other piece of it is, it seems like even though we're really brief, we seem to have stronger effects for families who are at higher risk. So we thrive where there is actually a history of involvement with child protective services. There's legal problems in one or both of the parents. A parent has a history of mental health, or both parents have history of mental health issues. Also, kids who have higher rates of problem behavior coming in do better than those with lower. We just show greater changes over time. So who's appropriate for the family checkup? Well, a lot of families are, but especially children of all ages, those showing families with parents who have high levels of stress in their current lives, history of mental health problems, sometimes a history of involvement with child protective services with another child over time. Those living with low economic resources and often living in poor neighborhoods over time too. Yeah, and of course kids, well, most of our referrals come with kids who are already showing emotional or behavioral problems too. Yeah, in parenting, and you can see some of our predictors. So we kind of thrive. We don't back away from families that have worked with other interventions and not found a lot of success, or just families that, boy, have a lot going on and seem to be in perpetual crises. That's kind of our wheelhouse. I mentioned we were in different settings over time. We've been stationed at mental health clinics for school-age children and adolescents, but I was really interested in moving us into early childhood. That's where I did my other research. So we really tried to focus on platforms and settings that promoted health over time, rather than mental health clinics for really young children. So Our original trials I mentioned were done in WIC waiting rooms. Then we moved into pediatric care. We've been at the AIU, the Head Start, the Office of Child Development's Early Head Start, and then family centers in Pittsburgh, where if you're a part of a family center right now, any family center, is my understanding, can get you a family checkup if you request it. In 2020, we began what's called the Pittsburgh study with the goal of making family checkup and other interventions much more accessible. I'm going to get to that in a few minutes. Our goal, which started before the pandemic, right before the pandemic, March 2020, was to actually get as many as 8,000 kids. We haven't gotten that far, to say the least, but we're up to about 1,100 right now. Over time, we're working with Allegheny County Child Protective Services and what's called Hello Baby. I don't know if you guys heard about that, trying to engage high-risk families with histories of maltreatment, homelessness, mental health, substance use, and other types of economic challenges over time. We're also now working with the Allegheny County Family Courts for parents dealing with the reorganization of their family during and or following divorce over time. All right, take a breath. Before I get into the Pittsburgh study, are there questions or comments about anything I've said? I can't see you, so you'll have to, I see someone's raised their hand.
Hey, Dr. Shaw.
Hi, Joshua, please.
Yeah. Hey, so I noticed a statistic a moment ago that the program lowered the percentage of maternal depression. Was there any study done, any info on like what it did for, depression, potential depression or anxiety in fathers?
Oh, great question. I must say we had fathers in about a third of the families participated in that. That project was about 700 families, and we had dads, and we have a couple of grad students have looked at it. It did not affect depression, but it did improve their parenting of the dads that participated.
Cool.
It's kind of interesting, yeah. And the level of depression, that we screened for families in this WIC sample, so that the average level of depression was really high for moms. It wasn't as high for dads, which might have had to do with why we did not see that as much. But we did.
Or it could have had to do with dads not opening up about it. Honestly.
Yes, absolutely. Yeah. They might not have admitted to that. Absolutely.
Cool.
Yeah.
Thank you. Thank you for your time there.
Any other questions? I know I speak pretty quickly, I've been told.
One question I was going to ask Dr. Shaw is, I know that you guys see a lot of family that's already going through. Is the family checkup used as a preventative if you're not having any problems with your child as well?
Oh, great question. You know what? Not many interventions will admit this, but I will say, like, my family would benefit from a family checkup, right? I think. My kids are all grown, but when we were young, boy, that would have been wonderful to have. I think it's a matter of, I think most families would find it helpful, but we won't see behavior changes in families where kids are already doing well. So when resources get tighter, like working with Department of Human Services and they want to focus mostly on, families whose kids aren't doing well or whose parents aren't doing well over time. But honestly, I think it would help most families, but I don't think our society could probably afford it to service all.
Well, thank you for answering that question.
Yeah, it's a really good question.
Go ahead, Colleen.
Yeah, I have a question. I'm not sure if it was mentioned or not, but my baby, she's 14 months old, and she's showing like early signs of either like a speech delay or maybe autism. But does your interventions help with that, or is that just like early intervention?
Great question. It's really, as you know, it's really hard to detect something like autism before age 2 is really tough. And we would, in most cases, refer directly to EI for if you're worried about, perception, hearing, vision, those kinds of things. Yeah. What's cool is because we're located in pediatrics, we can connect you right back to your pediatrician if we see something like that. So we detected it, but we would not provide that thing.
Okay.
Is that her?
Yeah, that's her. She's watching Bluey. So
Oh, cool.
yeah. Yep, that's the only question I had. Thank you.
Good question.
Go ahead, Natasha.
Hi. If you hear my background too, my 18-month-old, well, he's 20 months old now. He's watching Bluey.
You're right in the middle of it. Yeah. Yeah. Go ahead.
I'm watching Bluey. My baby's watching Bluey too. So I heard, did you say something regarding that family centers may have relationships with you? Okay, so the reason why I want to ask about that is because I work for a family center. We're really a small family center, and I'm not sure if my supervisor, because sometimes I'm the one that's like the front end that brings like a lot of light to things that I hear about. And I want to get more information on, if she's not aware about this, how can we learn more about it so we can have this relationship with our center, with you guys, to reach myself, because I want to get involved, but to other families?
Yes, great question. We were originally only at 9 of the 27 family centers.
Okay.
We had a contract through the state, but with the and this whole, as you know, there's a reorganization. I think it was called evolution of family centers, right? That the Department of Human Services had. And under that system, all of a sudden it's centralized so that different family centers can offer, in-home or in-house or at family center services. And my understanding is we are part of that, but it's not well known. And since the pandemic, there's kind of been a moratorium on going back to family centers. We've made, I don't know how many presentations when all the family center directors get together to let them know we're available, but the word doesn't get out per se. So which center are you at?
The Hill District Family Center.
Oh, you're at the Hill District. Yeah, it is available. I can tell you that.
Okay, and it's for home visiting?
It is, but it can, a lot of families are preferring Zoom, just like tonight. So that seems to be the norm, to do it through Zoom.
Okay.
But we will come to your home if you want us there, if you'll let us in.
No, what I was asking is, the family centers I think started last year, that's optional, if they have the staffing or availability needed. You can opt in to not do home visiting and just do the programming and services side. So for our center, we're not doing currently in the fiscal year, which is July to June, we're not doing home visiting. And come July, my supervisor is saying that we're still short staffed, and it looks like we're still not going to do.
Gotcha.
So therefore, this is a home visiting. It's affiliated. Is this tied in with home visiting?
It is, but because it's remote, it feels like that should not be a
so I want to see how I can talk to her about this without using that home visiting word.
And we have staff available to see families now. I mean, we have this contract and they're not taking advantage because we're working a lot with their Hello Baby project over time, but we have staff right now that could see you and stuff. Yeah,
because we're working with Hello Baby all the time too. So I really want to. Okay, so how would I be able to get more information for her to contact your staff?
If you could convince you just have to convince your director to call the lead person at DHS, and I am blocking on her name right now. I want to say Tamar, but I'm not sure that's right. But the person who organizes all the family centers at Department of Human Services, just to call her, and she'll hook you up with Amy Mallon, and Amy Mallon will get you services if you want that.
Okay, all right, sounds very well. The lead person for DHS, and this is for the family. I keep reading it.
Family checkup, yes.
Family checkup. Okay, thank you so much.
If you want to call
someone, email tonight.
You could call someone on our staff named Val Chavis, and Val used to run the East Hills Family Center for 17 years. She can also make that connection for you. Okay,
Val Chavis.
Yeah.
Okay, is she still in the loop?
She works with me, and Val's number, let's see, where is Val on our list here? Come on. It's a little too late for me to get through this. Where is it? Oh, here we go. 412 523 4840.
Val Chavis.
Yeah, Chavis.
Okay, I'm doing. I hope I get a raise. I pull
Good
this
luck.
off. Thank you.
Sure. All right, I'm gonna go on then to the Pittsburgh study. People are all right with that. Let's see if I can find my place. All right, you see this? I could spend an hour on this slide. I apologize, but the Pittsburgh study is this huge beast that was organized by folks at Children's Hospital, UPMC, and the University of Pittsburgh, and several foundations. And it was thought of as a way to meet the needs of children all the way from pregnancy through adolescence. And with Deborah Bogan, who is now Secretary of Health for the state of Pennsylvania, we began this project during the infancy and toddler, so the areas in green. And our idea behind this, I'm going to go to the next slide, was to say, well, here are the people involved. And you might recognize Janae Wilson from the health department, Deb Bogan, who used to run the health department in Allegheny County. And then there's Val Chavis. Now you know what she looks like when you call her, and myself and Amy Mallon. And what was cool is that from the beginning, we were partnering with people who funded projects like ours to begin with. So a lot of times in academia, you do these projects and they get published and nothing happens. So from the outset, we wanted to be with our community partners. And you can see all the different people involved in this. Enough about that. So here's the background. Accessibility of services, that was the key. If anyone's seen the movie Field of Dreams, the question was, if you build a baseball field, will they come? If we provide the services, make it convenient, will it happen? We also wanted to acknowledge the heterogeneity, big word, of risk, meaning that family stressors and families come in all sizes. And the idea that one intervention, like the family checkup, would be the best model for every family is a little insane, frankly, right? I said you'd benefit, but you may not need that if things are going well. We wanted to fill this gap to make interventions more accessible and to tailor them to individual families' needs. That was the goal. So even though this is officially a research study, it's all about finding better ways to serve families. So here was our vision: to address the chasm between knowledge of early factors that promote children's welfare and our ability to engage families. So we know a lot about interventions when families come to us, but we don't know how to attract families to engage them when they're not coming to us and they're hurting over time. We used two ideas: principles of behavioral economics, which means you get supported, even sometimes get paid for doing something that makes sense for your family's health in this case, and something called common sense, to make evidence-based programs more accessible to families at locations that they're already using and are easy to get to. That could be your home, or it could be the library or your pediatrician's office for your child. So we call this a tiered approach, so that you get a choice of evidence-based models that are consistent with what you report to us about strengths and challenges in your families. We want to make the reason you say no something else than I can't make it because it's inconvenient. If you want to say no, we agree with you completely, but we want to make it easy to say yes. The idea behind the project is, if engagement is high and program benefits are found, maybe we could not only help families, but change social policy so it was easier for families to access these services. So, based on the primacy of parenting, how important it is during early childhood, we focused on parenting programs. Programs needed to have show some long-term effectiveness for improving child welfare. They had to have a record of being able to engage families well. They can't be done at families. They had to have ways of making it easy for families again to say yes. And we had to make it so that the families could be offered in non-traditional settings. So you didn't have to go to a mental health clinic per se, but it could be done down the hall in your pediatrician's office, in your home, at a WIC site where we, before the pandemic, got them to agree to give us space so you could do it at your WIC appointment over time. Family support centers we talked about, they've been wonderful in all this. And then through the pandemic, being able to do it online and remotely. A lot of families don't want to come in, they don't want someone in their house, but they're willing to go on a Zoom call like tonight. Yeah, and then COVID happened, as I mentioned. We were starting this in March 2020, and if people remember, that's when the pandemic happened. So we were just kind of blown away. So you see different programs here. One is the family checkup, which you've heard a lot about. Another, even a more intensive program that the health department provides is Healthy Families America. There's also another program. I'm going to show you in a second what it is. Oh, and I better stop. Hold on. I better get my video settings back. Hold on. Share screen. Oh, they were optimized. Good. Never mind. Thought we were going to lose the video. Family centers are amazing, of course. And then something called Nurture Program, which is just a texting program. If you have an issue, people there. If you have an issue, but you don't want someone visiting your house or seeing you, this is all a texting program to ask for advice. What happens when my baby's colicky? I need someone, and you just text back and forth. And then Text for Babies. Any of us could get on this program right now. It's online. It's passive. You can ask. Well, you can find out information, but not much more. You don't have a person on the other line who might be able to help you. But we thought, based on families' strengths and challenges, we could cater families to these different programs. So one of these programs we're really excited about, and we've been using in Pittsburgh with Family Checkup the last like 6-7 years now. And it's called Video Interaction Project, or VIP, and it's designed to build on a program called Reach Out and Read. Some of you might have experienced this by having someone come up at a library or pediatrician's office and say, do you mind if I read to your child over time? But this time, you're going to get direct feedback on your parenting very quickly as part of your visit to your pediatrician's office. Every time you go, you get a toy or a book, a learning material, which you get to keep. And then you get video recorded for 5 minutes playing with that toy or object with your child. It's really cheap, $250 per year. And let me show you what it looks like. This is only 1 minute, this one.
Sounds, image sound, and then expand on it. She loves it when I talk to her. She's clearly communicating with you that she loves your voice. This is a book. It gives you a lot to talk about. It gives you lots of colors. You can talk about the sound. There are different textures, so you see how things change.
What's that, little bear? A fishy. What color is the fishy? It's pink, right? Your favorite color besides purple?
You're constantly talking to her throughout the whole sharing of the book. It's pink. I love this part. You related it back to something that's very much to her.
It's purple.
What would you like to continue doing with her at home with the book? What would you do?
The same thing. Play with her, like show her the different colors. Oh, and also like I could also make up stories,
Absolutely. See you soon.
Bye.
We love Video Interaction Project. Not only it's great because more fathers are showing up for those well-child visits, so it's done in combination with whoever is there. Sometimes dads alone, sometimes moms and dads. You saw moms, but and it was developed with mostly immigrant populations in New York City. So we were one of the first cities outside of New York City to use the program. over time. So you know, you might have noticed when you had a child, you didn't get a manual or anything to go with it. And this just provides instant feedback on things you can do to, especially in early childhood. So I'm going to just briefly tell you a little bit about how the Pittsburgh study works and how you would get involved in this kind of thing. Recruitment happens. Then there's a 30-minute survey. So this is where we can find out what programs would work best for you over time. You get paid $30 for this, so we think your time is valuable over time. As you're doing it, it's scored in real time. And then we have these different tiers based on your strengths and challenges over time. So if you're pretty well resourced economically and you're reporting lower challenges, we're going to tell you about Text for Baby and family centers and maybe the nurture program. But if you have lower resources, but are also saying lower challenges, we'll say, wow, VIP would be great to get you off to a good start. As things get a little more challenging and resources get thinner, we're going to offer up family checkup. Smart Beginnings is actually a combination of VIP and family checkup. And then for families who are really struggling, they might have had a child removed already. They've had one of the parent might be serving time in jail right now, or has a history of mental health or opioid use that's ongoing right now. These families need, or I think, more support than our families way up here. So you can see each time there's a menu of options, and so families get a sense of control, of choice. But of course, you can just say no thanks, which is also great. So the interventions range in intensity. They're delivered at convenient locations, as I mentioned. And what's cool is that every 6 months, we ask you to fill out the same questionnaires, sometimes changes one or two items because your child is getting bigger. And because of that, we'll vary the questionnaires we give to you. So every 6 months, we might offer you a different program depending on how you're doing. If you're doing better, we might discontinue one, or we might say this one might also be available for you over time. I mentioned our best laid plans. We were doing all this in person, everything before the pandemic, and we've had to pivot and do everything remotely. All of our intervention programs between March and June learned how to work remotely, including Healthy Families America, VIP, Family Checkup. Fortunately, Nurture program was already that way, so they didn't have to change too much. Changed our recruiting strategies. Everything was remote. It was awful. And you can see over time families in these different levels, but they're pretty evenly spaced in terms of the 4 different groups. We worry more about these families than families, let's say, up here, per se. And this is how it breaks down. Like in group 1, we have very few risk factors, whereas in group 2, most families are fairly poor economically, but are having low levels of other risk factors. Here, we have families who have a lot of history of mental health issues over time. And then here we see families with really, really serious challenges, been involved with child welfare, incarceration, opioid use, recent homelessness, over 40% of our families there. And that's in the last year and a half. So what's happened so far? This has been going on for about 2 years. And we've recruited, I mentioned, about 1,100 parents. Parent ones, imagine a lot of our recruiting is in McGee Women's Hospital and WIC sites, where a lot of our moms just had a baby. In fact, all of our moms just had a baby. And so parent ones are mostly mothers, but we're getting about a quarter of dads to participate. Sometimes moms want nothing to do with us the day after, but dads will say, sure, I can do this. And you can see the proportion of race and ethnicity of those families. What's really, well, a lot of interesting things. Of the parents who are reporting clinically significant levels of depression, 80% of them, of mothers, and back to our earlier question, 81.5% of mostly dads are engaging in one of our more intensive interventions, VIP and or family checkup. So we're really, so in other words, we're getting families who are having need are saying yes to us, which is great. In fact, overall, almost 83% of parents, when we first approach them, that first assessment, say, yes, I'd like to get involved in one of your programs. And because we see them every 6 months, after 6 months and a year, we add another about 4%. So, about 86% of our families we asked to be in these programs are saying yes, which is great by making them more accessible. Interestingly, the breakdown for different groups, those in the higher 2 groups are more likely to say yes than those in the with higher resources and lower challenges, which makes sense, but it's still, there's a history of interventions not being able to engage families most in need. Here we have the opposite. We're engaging the very families most in need, which is really nice to see. 2 more slides, actually 1 more, this is it. So we think the Pittsburgh study is exciting. Our initial findings support giving families choices, tailoring families' needs to specific intervention. We have this central system for engaging families. And we think our strategies were especially successful for families at greatest risk, which we're really, really happy about. Our goal is actually to now change social policy to adjust for this. We still have challenges. Transitioning to remote recruitment has been an ordeal, but we were able to do it. We've had more staff turnover than in my entire 30-some years of working in this field, but that comes with a pandemic. And then sustaining funding. And unfortunately, right now, we're kind of in a holding pattern. We can't recruit any more families till some more funding comes through. We're hopeful that will happen in the next few weeks, actually. So fingers crossed on that. If you want any more questions or have any more questions about anything I've said, there's my, just remember casey@pitt.edu. And there's our website where you can find out more about our work. Let me stop sharing.
Thank you so much, Dr. Shaw, for all of that amazing information. Very informative.
For listening.
Anyone have any other questions for Dr. Shaw?
Wish I could see you all. Shonda, I see you. Oh, a raised hand.
Go ahead, Sammy.
Hi, I'm Sammy. Sorry for my picture being off. I'm trying to cook at the same time. I have an autistic child that also has intermittent explosive disorder.
Oh, wow.
And also ADHD on top. Can you let me talk for a second? Sorry, that's my theory. And they also, both of them also have child insomnia on top of it. Both of my kids, my youngest kids have child insomnia with my 5-year-old who has all those diagnoses. Would your program work for either of them?
We could provide you with some parenting strategies. I assume you're already involved with some care for your child who's on the spectrum. Is that correct?
I actually just signed up for a service coordinator today.
Good.
So I have tips for public schools psychologists that actually help me with that.
Excellent.
Today. I know. Sorry. Someone's trying to help me make muffins, corn muffins. I also have Wesley's family support for my daughter.
Nice. That's really good.
But it's like I don't know nothing. Like I have no knowledge of any of this because she just was diagnosed. So it's like it's kind of frustrating. I'm trying to get as much support as I can.
I see.
You know?
Yeah, sometimes less is more, but sometimes not. So we don't want to get in the way of other people working with you. But if there was a specific issue like, parenting one or both of your kids, that is our kind of specialty per se. And if you don't feel like you're getting that specific support from either of your providers, that's something we could help with. Yeah.
Okay. because I didn't know if, like, with my youngest having the child insomnia, if you would be able to help me with parenting skills for that or not. That's why I'm wondering. Like, since I got all the help for her, I need to learn better parenting skills.
Yeah,
with
I mean, that's what we do. So getting into routines and structuring and things like that could help with this insomnia too.
Okay, thank you.
Sure.
Thank you so much. Anybody else have any other questions? Well, thank you so much for your time, Dr. Shaw, this evening. I appreciate you coming out and speaking to our families. Oh, wait, we have one more question. Go ahead, Joy.
Yeah, I put my question in the chat, but I guess it's okay. So I was referred for PCIT for my son, but I've been unable to schedule for him. I wasn't sure if having a family, counseling would be an alternative.
Yes, PCIT is great, by the way, and very similar in terms of what you might be doing eventually in family checkup. So after you get to the end of the checkup part, if you wanted more intensive services, we would provide that, much like PCIT. So it would be an alternative per se.
Okay, yeah, because it's been, I guess, staffing issues just across the board.
Yeah, it's
right.
True. It's
yeah,
true.
So we haven't been able to get him scheduled, but we are on
Oh.
a waiting list at one of the facilities that I reached out to.
How old is your child? The one?
He's 3.
Oh yeah, great age for us and PCIT. It's perfect age for both.
Yeah.
Yeah.
So I just had a follow-up, like, would I need to go back to his pediatrician for a referral, or what would I do?
You could call Val Chavis too about it, and she could hook you up, get you referred.
Okay, thank you.
Sure.
And sorry I missed your question there in the chat there, Joy.
Oh, it's all good. Thank you.
Natasha, time for one more.
Yeah, no question. Just wanted to say a comment that I really am, fascinated by, the research and the work that you've been doing, and because I've done a ton of resources, and this is one resource that's always been in my heart that I was never able to find, is help parents parent. Including for myself. I have been looking at different nonprofits and every kind of resource. And it's just I have found everything to fix my child mentally, emotionally, but what about me in my home, how I'm raising my child, and what I can do to be a part of making it better, instead of just having everyone else just, work on what's outside of the home. So I just wanted to say thank you for what you've done. And I'm so excited to call Val tomorrow. And I'm really passionate about this. I'm going to try to make something out of this. I'm about to be working with you soon, because I am just so excited about what you're doing here. Because I've been doing resources for years, and I've never came across anything like this before. And this is what I've always been. Parents really need this. I see families all the time, and it's just there's this such drastic. You're ready to take the child out the home. It's just the parent needs to learn how to parent. They love their child. That's the foundation. They just need help, communicating and understanding and patience and everything else that comes along with it, and learn how to play with their child and listen to their child. And no one's teaching that. There's no resources out there for that. So thank you for coming today.
Sure. Yeah. Working with the Department of Human Services, I've come to respect them. They really don't want to take children away from their parents, and they want to do everything, but getting the word out that these resources are here. I mean, you nailed it. It's just not accessible. We really want to change that for families.
Absolutely.
Thank you so much for that comment, Natasha. I appreciate you.
Really cool.
Sure.
All right, we will not take any more of your evening, Dr. Shaw.
It's all right. Any more? I'll stay here if you have them.
Okay. Anybody else want to share or questions or anything? Okay.
Thank you for being a great audience. Take care.
You take care as well.
Good night, Dr. Shaw.
Good
night. So, I'm going to go ahead and